Fasciotomy update. Surgery went very good. Immediately after surgery, weight bearing was allowed. That was good. I could walk. Obviously, it was very sore. Yeah, it's a week in so far. Then we got another week of recovery. Right now, it's feeling really good. Still a little sore, but feels really good. I can walk around pretty normally now. Yeah, so one more week of resting, and then we will do PT, and then it's off to riding the bike finally. So yeah, so I'm taking blood thinners and baby aspirin prescribed, so I don't get blood clots. And yeah, everything's going good. But took the wrapping off after 4 days, so yeah, everything looks like it's starting to get healed up. Really nice. And yeah, it's not pretty sore. I mean, I can't like lift my toe up that much because this is the muscle that lifts up the toe, but that's normal because it's sore. Or not the toe, the foot. Yeah, it feels pretty. Besides that, it feels good. I will do another update when next week, when they actually take off the strips that are covering the thing. It should be all healed up, and I'll show you the scar of the cuts, and document my process of the PT to get back into it. And yeah, because when I looked into compartment syndrome surgery and videos about it, there was not very many videos about it besides this one girl. So yeah, to kind of re-explain to people who are watching this who for the first time, compartment syndrome is where there's different compartments in the leg, and there's something called fascia, which connects it's just connective tissue all over your body between bones and stuff, and it separates muscle groups, like it's around muscle. And so this compartment of my leg, this is the part I'm having a pain with, and so the muscle group, if you cut the leg from here and you look from down below, around the muscle groups there is a white lining that is fascia. That's what separates it, and it keeps the muscle integrity and everything. And so the fascia was so tight that when the muscle tried to expand, when I was exercising, blood was going to the muscle would expand, the fascia was just constricting it and not letting it expand at all, causing crazy pressure and basically depriving that area of oxygen, causing burning sensation, and it would swell a lot, and it was just rock hard. So yeah, it's the pain I'd get, and it would subside after exercise, but also like it would still feel always tight. It was always tight down there, and it was always like having a problem, but like it wasn't like necessarily pain, like the burning pain that would happen from exercise, running, cycling, anything. And so with the surgery they do, they make an incision like this here, they cut it open, the skin, open it up until they find the white fascia, and then you just take scissors and they just cut it. You just cut all of it, one slice, and boom, it releases the muscle, so the muscle can expand normally again. Yeah, so yeah, they just go in there and cut the fascia like a zipper, and it's supposed to release the thing, so when you exercise again, the muscle can expand normally again. And yeah, so in the recovery for this 2 weeks, like I said, you can have compartments in different areas. Like you can have it in your calf, and you can have it in several compartments, which could be a long time to recover because if you have slices in your calf and shin and all that, interior shin, it can be a long time to recover. Yeah, I feel okay. Blood's like flowing nicely, nicely to the muscle. Obviously I haven't ridden a bike, so I don't know if it fixed it yet. Hopefully it does. But like what I noticed is like it's very supple now. Like I can like touch my shin, like, and it's just my finger just like squishes into the muscle, Whereas before, like I remember, like it was like rock hard. Like it was like you couldn't, like it was just rock hard tense. Like just the fact that it's like nice and supple in there, and it feels like blood is flowing better to there. So I think it's going good. I think it worked. Obviously I haven't tested it out yet. So quick side note here, for compartment syndrome, there's things you can like try to do to fix it, but like resting doesn't really fix it because it has to do with how tight the fascia is around the muscle, and if the fascia is always tight, the muscle is always going to be constricted. So like really the only route to fix it is pretty much surgery and some and other things that can help decrease the pressure. Like I've heard about this thing where they inject this thing that into your shin to reduces pressure, but like it's not like super high success or anything. So surgery is like the best kind of like best and pretty much the only way to like kind of fix it. And for compartment syndrome, people can have they can have two different types of compartment syndrome. They can have injury induced and exercise induced. Exercise induced is pretty rare, which is what I have. But usually what happens is pretend someone takes a bat and just like slammed it super hard on your shin, and your muscles are swelling so much because of how like bruised up and like bad it is. And obviously the fascia is what it surrounds the muscle. So like, and if the fascia doesn't let it expand, the muscle expand, and that's super high pressure and can destroy your blood vessels and basically kill off. You could even lose that limb if it's super severe, because of how much pressure there is in there from the fascia not letting the muscle expand, basically starving the limb of oxygen. This is a very medical emergency. Like if you have that, then you need to go to surgery straight away and get it done. This is injury induced, like it can happen in car accidents. No, this is not what I have. It's exercise induced, so mine is basically from overtraining and also genetic. So if your fascia is already tight, maybe genetically in that area, and you're doing training, maybe your body's absorbing the training, but your fascia like is just not dealing with it, and you can get this problem and it doesn't really go away. But yeah, so like also when you ride a bike, you're doing just one leg's going half a circle, the other leg's taking over doing half a circle. So it's like a very limited range of motion, which can, if you're overtraining that, it can really tighten and shorten the fascia, making it even worse. So it's half genetic and it's half like overtraining. It's kind of rare to get it, and usually usually it's not a problem you should have. But if you do, like, just go ask a doctor. Another thing to know is for physical therapy, it should be like 4 weeks before I can start like riding again, because obviously I'm gonna have to lose the range of motion in my foot because of the surgery and strength. Like for instance, this muscle here, it lifts up the toe, but obviously you can see I don't have very much range of motion there, obviously because they did the surgery in that area. So obviously you got to build that back up and the strength in that muscle, and just And another thing I noticed is after I was done with the surgery, like the doctor said like my muscle like literally sighed with relief. Like when they cut it open, it just like expanded like into back to normal. Like when you cut the fascia, it just in the shape, like it was really restricting it. So that was good to hear. And how do you figure out if it's compartment syndrome for people who think it is, who have the same kind of pain? So you go to a doctor and they have this meter thing, and that they stick into your shin. It's a needle, and it measures the pressure in the compartment. If the pressure is above a certain amount, it means you have compartment syndrome. And when they did it to me, even while resting, without any activity, the pressure was insanely high. And then even with exercise, the blood flows, the muscle expands, the pressure was even higher. So if you have above a certain amount of pressure, it is compartment syndrome. So that's how it's tested. Thanks for watching, guys. Stay tuned for some more updates. I also got a cool video I think I'm gonna do of screen recording, going through all of my Strava rides for my first year of cycling, going through all the crazy adventures I had. So stay tuned. That's it. Bye.